President Trump is once again at odds with the nation's top medical experts. Earlier this week, the president claimed that a coronavirus vaccine would be available before Election Day on November 3rd. He also defended those who choose to go against the advice of health officials by not wearing face coverings in public. But during a Senate hearing on Wednesday, Dr. Robert Redfield, the director of the Centers for Disease Control and Prevention, predicted that a vaccine would not be widely available to the public until mid-2021. Redfield also said that the use of face masks is as important as a vaccine. Those statements led President Trump to claim that Redfield was confused, while White House Chief of Staff Mark Meadows said the CDC director was out of the loop. CBS News White House correspondent Paula Reid has the latest.
President Trump continued to claim today that a vaccine will be ready very soon, a prediction critics say he's making with November 3rd in mind.
The vaccine is way ahead of schedule, but I'm being criticized for bringing it back too fast.
But the CDC and most health experts say Director Robert Redfield's timeline of late spring or summer next year for most Americans is accurate. A former senior administration official tells CBS News the White House cares more about messaging than solving the problem of the virus, and that they're being asked to do things they don't want to. The tension between the two was on display Wednesday when Redfield discussed the availability of the vaccine.
I think we're probably looking at late second quarter, third quarter, 2021.
I think he made a mistake when he said that.
Former acting CDC Director Richard Besser.
When you see the president publicly undermining the head of the CDC, it gives people room to question the public health advice. And what's happening in this nation is people are choosing whether or not to follow the recommendations of public health.
One former White House official upset with the president's handling of the pandemic is going public with her endorsement of Joe Biden.
I'm Olivia Troy.
Olivia Troy, a former Homeland Security advisor to Vice President Mike Pence, released a video today describing what she saw in the White House.
When we were in a task force meeting, the president said maybe this COVID thing is a good thing. I don't like shaking hands with people. I don't have to shake hands with these disgusting people.
The vice president dismissed her concerns.
It reads to me like one more disgruntled employee who's left the White House and now has decided to play politics during an election year.
And Paula Reid joins us now from the White House. Paula, are Dr. Redfield's comments impacting his standing within the administration? And what else can you tell us about the larger relationship between the White House and the CDC?
A source close to Redfield says he does not intend to resign from the CDC despite publicly clashing with the president. We've seen this before with other officials. For example, Dr. Fauci's had public disagreements with the president but stayed on. Many of these officials, including we're told Redfield, believe that they can be of the most use when they're inside the government, so they kind of roll with the punches in these controversies and remain in their post. But the larger relationship between the White House and the CDC is certainly strained. You have CDC scientists worried that the White House currently has such a tight grip on the messaging that a lot of important public health information is not being disseminated. You have former administration officials who say they're worried that those same CDC scientists are under a lot of pressure, as are other health experts, to approve a vaccine not because of science, but instead because of political reasons to help the president. But then you also have the White House that believes it is being undermined by the quote-unquote deep state. We just saw Health and Human Services spokesman Michael Caputo. He's taking a leave of absence after suggesting in a Facebook Live that deep state actors in the bowels of the CDC, that's a quote, were trying to undermine the president and trying to slow walk a vaccine and some therapies to decrease the president's chances of re-election. It is an extremely dysfunctional relationship. It has been throughout most of the pandemic. The CDC has certainly made mistakes, of course, as has this White House, but it certainly does not serve the public to have such a contentious, fraught relationship between the White House and its lead health agency.
Playing out so publicly. Well, Paula, as you mentioned, a former top advisor to Vice President Pence on the pandemic is criticizing the administration's response to the virus and is now supporting Joe Biden. What more can you tell us about how the White House has been responding?
That's right. Olivia Troy, she was a Homeland Security advisor to Vice President Pence. She also had a role related to the task force, but it's not clear exactly what her role there was. The vice president has just dismissed her as a disgruntled employee. But moments ago, President Trump actually was asked about this as he left the White House. He said that he did not know her. He said it's, quote, just another person who has left. But he also referenced her going away note, her email that she sent out. He said it was, quote, beautiful. And Vice President Mike Pence's office has also shared that note with reporters when they've been asked about this particular employee. The gist of her note is that she enjoyed her time here. She was very collegial. So they're trying to use that to undermine any other statements that she has made about the president. In that video that she released, she expressed concerns about things she heard the president say during her time here in the White House, particularly about shaking hands with people. We know the president was a germaphobe before he came to the White House, but she found that comment, that was the upside of COVID, that he wouldn't have to shake hands with people. She found that to be in bad taste, and she said that based on her experience here, she is now among the many former administration officials who will be voting for Joe Biden.
Well, Paula, the administration's handling of the pandemic and its conflicting messages remain a key focus of the Biden campaign. And the president's comments about when a vaccine might be available conflicting with the head of the CDC, his continued conflicts over masks. How does all of this play into his campaign strategy? We're looking at just about 6 weeks until Election Day. Is there a sense in the White House that the president needs to change any of these confusing, contradictory messages?
Well, we have seen a bit of a shift. The president has, of course, gone back to doing his, not daily, but every other day or so briefings. He had stopped those for a while because there was a concern that he was undermining his own administration's message. He's back to doing those briefings, trying to take more control of the messaging. But the president has even said himself, when it comes to the public relations aspect of COVID, that has really been their biggest failure. Although other people would look at the death toll, the way supplies have been sent out, the overall lack of a federal plan as being the largest failure. But even the president concedes that his messaging has not been great on this. But going forward, we still see the president nearly every day, and he continues to hold these briefings. They are taking a slightly different approach, but it's not right now. It's over the past month or so. They have shifted their approach, and it appears, look, they concede. They've made a lot of mistakes. Their messaging has not been great, but it doesn't appear that they're going to do anything differently over the next several weeks between now and Election Day.
All right, Paula Reid there at the White House. Thank you.